Good evening, doctors. Thank you for joining for the session today. I am Vijay, manager at Mediversal Academy. It's a great privilege for me to introduce today's speaker, Dr. Charu Lata. Dr. Charu is a BDS, a gold medalist, a PG diploma in orthodontics, PG diploma in aesthetic medicine and cosmetology. Also, co-founder and director of Mediversal Academy and a member of academy, a member of a committee. Dr. Charulata is an accomplished dental surgeon and a visionary leader in healthcare education, a proud recipient of gold medal in the Bachelor of Dental Surgery. Dr. Charu has consistently demonstrated academic brilliance and professional excellence. Over to you, Dr. Charulata. Doctor, you can unmute yourself now.
Hi, thank you so much, Vijay, for a wonderful introduction. Hello, everyone, and welcome to today's academic and informative session. I am Dr. Charu, a certified cosmetic practitioner, and my session revolves around hyperpigmentation, which is one of the most common but misunderstood topic. So let's start with the presentation. I will take just a few minutes to just share my screen. I hope it is visible to everyone.
Yes, doctor, it is. It is. Thank you.
Okay. So yeah, here we start with the presentation. And today we will learn about different types of hyperpigmentation, the causes and the treatment modalities that are present in today's time. Okay. So today's session consists of four parts, which is introduction, etiology, types, and treatment modality. So let's start. So before starting with hyperpigmentation, first of all, we will try to learn about what are the determinant or the determining factors that affects the skin color. Okay, so the skin color is basically determined by different pigments. So there is mainly this dominant pigment is there, which is known as melanin, and which is produced by melanocyte. If you can see the picture over here, in the सबसे bottom का जो layer है, that is known as the basal layer, उसमें एक brown color का एक cell है जिसके बहुत लंबे appendages हैं. So this cell is known as what? Melanocyte. Okay. तो ये क्या करता है, ये अपना पिगमेंट प्रोड्यूस करता है और डिफरेंट सेल्स के अंदर डिपॉजिट कर देता है. ओके, सो मेनली टू pigments are produced in our skin. That is, first is eumelanin, which is the brown colored pigment, and the next is pheomelanin, which is responsible for the red color of the skin. Okay, so if the melanin is absent completely, that condition is known as albinism, as we all know, which is a genetic condition. Okay, if there is a deficiency of melanin, यानी कहीं पे melanin pigmentation है और कहीं पे white patches है, यानी जहाँ वहाँ white patches है वहां पे melanin pigmentation present नहीं है, that condition is known as vitiligo. Okay, नेक्स्ट इज द ब्लड सर्कुलेटिंग थ्रू द स्किन. सो जो ब्लड है वो भी हमारे स्किन के कलर को बहुत ज्यादा अफेक्ट करता है ड्यू टू टिंडल इफेक्ट. ओके, सो इट गिव्स अस द रेडिश ब्लू कलर. इट generally, you know, it increases during anger or during inflammation or during, you know, excitement or during flushing. Okay, flushing, I mean in blushing. Okay, next is thickness of stratum corneum, which also affects the color of the skin. Okay, so हम ये देखते हैं कि मेलेनिन एक्चुअली में प्रोड्यूस कैसे करता है. So there are different amino acids which we get from protein breakdown. So these amino acids are also, first of all, we get these amino acids through nutrition, and the second thing, we get these from cell. Okay, cell itself produces these pigments, sorry, these amino acids. So basically, this tyrosinase is an enzyme which helps tyrosine molecule to convert it into this fibrillar matrix, and then यहाँ पे ये composite होके और फिर ये melanin pigment बन जाता है, which is then deposited in our skin. Okay, so wait 1 second. Yeah. Okay, so discoloration is what? When the color of the skin is different from the adjacent skin that you can differentiate from the adjacent skin, then this condition is known as discoloration. Okay, now these can be present in different patches which can appear brown, red, white, pink, or purple. Purple in basically in purpura, or black depending upon the reason of the discoloration. Okay, and this often responds to either of the underproduction or the overproduction of this melanin pigment. Okay, there are different causes of pigmentation which are basically enumerated here. As you can see, in birthmark, infection, skin cancer. In skin cancer, which is basal cell carcinoma, which is the most common skin cancer, and the second most common cancer is SCC, that is squamous cell carcinoma, and then melanoma, which is also known as the very malignant type of carcinoma. Okay, then injury or trauma due to burns or blisters, allergic reactions, medications. Certain medications also cause hyperpigmentation. In the next slide, we will see what are all the medications that are responsible for hyperpigmentation in the skin, and then chemicals. If some patients comes, and you always have to ask them कि आपने कोई new face wash try किया है या कोई cream try किया है या कोई फाउंडेशन, बिकॉज टीनेजर्स में आजकल न्यू प्रोडक्ट्स ट्राई करने का, उनको रिव्यू देने का बहुत क्रेज चलता है, तो ड्यू टू व्हेन दे डोंट नो कि उनकी स्किन को कौन सा केमिकल सूट कर रहा है नहीं कर रहा है, तो उस कारण भी काफी बार रिएक्शन हो जाते हैं. Okay, which often lead to pigmentation. And certain, और कई बार क्या होता है कि लोग अपने आप को सेल्फ प्रिस्क्राइब कर लेते हैं some face wash, some depigmenting face wash or some detaining, and they go to like non-certified parlors and all, तो वो that allergic reaction even increases and result in more pigmentation. Okay, then there are certain skin conditions which are known to cause pigmentation, like vitiligo, melasma. Melasma फीमेल में बहुत ज्यादा देखा जाता है, और उनके नोज पे और चीक्स पे एक हाइपर पिगमेंटेड एरिया बन जाता है, जस्ट लाइक अ बटरफ्लाई. So that is also known as pregnancy mask or chloasma. Okay, then due to age spots or actinic keratosis, inflammation, lupus, Addison disease, and diabetic rash. Okay, these are different birthmarks, as you can see. Okay, these birthmarks are basically the areas of skin discoloration that appear at birth or shortly after, and basically they are very common in infants, and they regress spontaneously. Okay, so these birthmarks fade over time, while others are permanent or darken with age. These can be vascular or pigmented. Vascular यानी कि जो underlying blood vessels हैं उनकी वजह से होती है. Okay, now the first picture is of strawberry hemangioma. This is a vascular lesion and it regresses spontaneously. Okay, the next is stork bite. This is a completely benign vascular lesion, and this also usually fades with time. The third one is cafe you let spots. ये इसका जो नाम है, it is in French, which means जैसे किसी कपड़े पे या फेस पे जैसे कॉफी का स्पिल हो गया हो. Okay, so this is also a benign condition. नेक्स्ट इज मंगोलियन स्पॉट, जो कि इंडियन स्किन में बहुत कॉमनली देखा जाता है. एंड द लास्ट वन इज पोर्ट वाइन स्टेन्स. ये अपीयरेंस ऐसा लगता है जैसे किसी ने फेस पे या कपड़े पे वाइन गिरा दी है. ओके, एंड द पॉट वाइन इसलिए फेमस है क्योंकि इसका दाग जल्दी से हटता नहीं है. ओके, सो इसका जो नाम है, ये स्लैंग टर्म यहाँ पे यूज किया गया है. ओके, now, as you can see in the picture, these are pigmented areas due to some infection. Okay, so this pigmentation responds to the excess production and irregular distribution of melanin in the skin. Okay, this is most commonly known as PIH, or commonly known as post-inflammatory hyperpigmentation. And very common causes are acne. इससे पहले जो informative session हुआ था उसमें acne और acne marks के बारे में thoroughly explain किया गया था. So another reasons and most common causes are impetigo, tinea corporis, which is a fungal infection, herpes, which is a viral infection, and leprosy. Okay, these are certain drugs which induces hyperpigmentation. Okay, if you want a screenshot, I'll wait for 2 minutes. You can just take a screenshot of this slide. I hope it's done. So there is one more pigmentation which is commonly known as dark circles or under eye circles. So this is a dark pigmented area under the eye, which is basically caused by different things like hereditary or allergies or due to poor sleep. So जो heredity होता है वो by birth present रहेगा आपको, and due to allergy it will be temporary, and due to poor sleep it is very commonly managed, as you all know. Okay, so very common causes are smoking due to sun damage, caffeine consumption, alcohol consumption, due to sleep deprivation, dehydration, and certain dietary deficiencies. Okay, so this is a solar lentigo. It appears like this. This is basically due to sun exposure. Okay, हम जब sun में बाहर जाते हैं, if you step out in sun, so we are basically exposed to all the UV radiations. There are three types of UV radiation: UV A, B and C. तो जो A होता है वो हमारी skin में deeper layer तक damage create कर सकता है, which irritates the melanocyte and जिसका result में melanin pigmentation ज़्यादा produce होता है. Okay. So these also are known as age spots, liver spots, or senile freckles. Okay. So these are flat brown to black spots on the skin caused by chronic sun exposure and due to aging. Okay. It can also appear on face, hands, and shoulders. These are harmless, benign growths which result from melanin overpigmentation and localized melanocyte proliferation. Okay. So these basically go and respond well to peels and lasers. These are freckles. The freckles are flat, tanned, circular spots. They are multiple और ये पूरी skin पे फैले हो सकते हैं. Okay, and they are and they occur especially due to repeated exposure to sunlight. Okay, ये एक genetic condition भी हो सकती है. Okay, in this case, sun protection is non-negotiable in the management. You just have to remember this. Okay, so these are particularly common in upper body skin areas like skin, nose, arms, upper shoulders, etc. Next is melasma, which is a very common hormonally driven chronic and notorious for its reoccurrence. Okay, this condition specially requires a long-term maintenance. It does not respond to quick fixes. Okay, so melasma is a condition presenting as brown patches on the face and skin of adults. These usually occur in pregnant women and women who take birth control pills for longer duration. Okay, जैसे आप नीचे वाले फोटो में देख सकते हैं, नोज एंड चीक्स पे एक बटरफ्लाई शेप एरिया बन गया है यहाँ पे. Okay, men are commonly less affected because जो प्रेगनेंसी हॉर्मोन्स होते हैं उस वजह से ये कंडीशन होती है. So the symptoms are dark irregular patches which are commonly found on upper cheek, nose, lips, upper lip and forehead. Okay. Uh, okay. So ये थी सारी conditions. Now we talk about the treatment modalities. So first of all, we need to understand between skin brightening and skin lightening. Okay. स्किन ब्राइटनिंग हम तब करेंगे जब किसी की स्किन बहुत डल लुकिंग होगी या किसी को पार्टी में जाना होगा या फॉर मैरिज पर्पस कोई आके आपको बोलेगा कि मेरी 2 महीने में शादी है, आई जस्ट वांट अ पील और अ रिजुविनेटिंग प्रोसेस सो दैट कि मेरी स्किन थोड़ी ग्लो हो जाए, प्लम्पी हो जाए एंड रिजुविनेट हो जाए. देन यू हैव टू गो फॉर स्किन ब्राइटनिंग एजेंट्स और स्किन ब्राइटनिंग प्रोसीजर्स. ओके. So, these skin brightening procedures help with overall radiance while also providing brighter glow to the skin. While skin lightening, on the other hand, they reduce dark spots very commonly due to sun damage, melasma, post acne marks. Okay, so these are chemicals which inhibit melanin production. Okay, very effective is a very effective procedure is microderm abrasion. So this is a non invasive skin resurfacing procedure. This improves texture, mild pigmentation, but it is an adjunct. Okay, it is not a standalone solution. So this procedure gently exfoliates or polishes away the top layer of the dead skin and stimulates collagen growth. and to reveal healthy new skin that looks and feels smoother. Okay, so इससे आप क्या क्या treat कर सकते हो? Sunspot, dull skin, blemishes, fine line, wrinkles, overall rejuvenation. Okay, as you all know कि यहाँ market में एक available रहता है derma pen which have 24 or lesser than 24 needle system. So you just prepare the skin. Preparing the skin means gently exfoliate the skin, cleanse the skin, or apply any peels. I will discuss about the peels in the next slides. And then when you prepare the skin, after that you just either you can pour the plasma, or you can pour some skin lightening agents or skin brightening agents on the skin. And then उसके ऊपर एक पेन आपको सर्कुलर मोशन में और उसके ऊपर आपको मतलब ट्रीट करना है. ओके, then okay, so this procedure uses a special applicator with an abrasive surface. Okay, so this gently sand away the thicker outer layer of the skin. So a different microdermabrasion technique sprays fine particles of aluminum oxide or sodium bicarbonate with a vacuum or suction to accomplish the same outcome as the abrasive surface. This is completely painless and low risk skin treatment that can be added to the beauty routine. Okay. So different skin lightening agents are as follows. So these skin lightening agents perform by inhibiting tyrosinase activity, जो हमने initial slides में देखा था. Okay, so this in turn suppresses the pigmentation by inhibiting melanin production. Okay, first is licorice extraction, which is like जिसका एक common example है glabridine, which is the main ingredient in this, and it is suitable for all the skin. Kojic acid is a great option who are very sensitive to hydroquinone. Okay. ये सब एजेंट्स आपको स्किन के ऊपर अप्लाई करने से पहले एक पैच टेस्ट जरूर करना है, so that we can know कि if some patient is sensitive or is allergic to that chemical or not. नेक्स्ट इज विटामिन सी. इसको आप जो बाकी स्किन लाइटनिंग एजेंट्स, ओके, जो ये स्किन लाइटनिंग एजेंट्स है, ये ऐसा नहीं है कि सिर्फ सिर्फ लाइकोरिस को ही आपको स्किन पे अप्लाई करना है. आप अगर किसी को प्लम्पीनेस चाहिए और हाइपरपिगमेंटेशन हटाना है, और तो आप हाइड्रोक्विनोन, विटामिन सी और अल्फा आर्ब्यूटिन ये सब आप कंबाइन करके स्किन पे अप्लाई कर सकते हो. ओके, so there is vitamin C, which prevents loosen the bonds between skin cells and overall rejuvenates the skin. Okay, so इसके बाद में after these peels, after this vitamin C, the skin cell will come off on its own, and they will take away the excess melanin that creates the dark spots and the acne marks. All right, next is alpha arbutin, which is a safer skin agent for external use. It does not have any toxicity or unpleasant odor and side effects such as hydroquinone. Next are some antioxidant and anti-inflammatory agents, which is licorice again is an antioxidant and anti-inflammatory agent. Kojic acid, you can combine kojic acid with vitamin E, okay, which destroys free radicals. Then you have vitamin C again, alpha arbutin and chamomile and castor oil. Then there are certain antimicrobial agents. Kojic acid, as you know, this is a strong antifungal and antibacterial. It has antibacterial properties, which makes it ideal for treatment for acne and melasma disorders. Then we have panthenol, which controls growth and transmission of bacteria and prevents the bacteria from skin surface. देन वी हैव कैस्टर ऑयल. कैस्टर ऑयल आप हर एक सीरम में या मीजो कॉकटेल्स में या डर्मा कॉकटेल्स में आप इंक्लूड कर सकते हो, बिकॉज इट पेनिट्रेट्स द स्किन इजीली. Okay, next is chamomile oil, which is antibacterial. Again, it has antibacterial, antifungal properties, and it causes the skin tissues to shrink and minimizes the pores and gives a lifting effect. Okay, which facilitates skin contraction and combat infection and irritation. Then there are certain moisturizing agents. इन्हीं का एक इफेक्ट मॉइस्चराइजिंग भी होता है, so that's why ये नाम बार बार यहाँ पे आ रहे हैं. You can add vitamin E, okay, which naturally prevents water from leaving the body through skin block. Okay, लेकिन इसको आप ऑयली स्किन पे नहीं यूज करोगे, नहीं तो वो स्किन और ज्यादा ऑयली हो जाएगी. ओके. सो सॉरी, वेट. ओके. So this is the timeline up to till up to how long these hyperpigmentation treatments will take to work. So retinols will take around 24 weeks, and AHA peels will take around 22 weeks. Azelaic acid will take around 12 to 16 weeks. Arbutin 12 weeks. Kojic acid 12 weeks. 12 weeks. Vitamin C will take 8 to 12 weeks. Resveratrol will take 8 to 12 weeks, and niacinamide will take about 6 to 8 weeks. Okay. So these are very common products, और इनके साथ में इनके ingredients भी हैं. If you want, you can take a screenshot of this slide. I hope it's done. So yeah, first we'll start with hydroquinone. Okay. This is a very powerful medication which treats melasma, age spots, freckles, dark spots, and post-inflammatory hyperpigmentation. Next, we have tretinoin in a 0.05 percentage cream, which is effective against skin pigmentation issues like melasma, PIH, etc., which improves the skin texture and diminishes dark spots. This is a retinoid, so you have to avoid in pregnant patients and in lactation women. Next is tazarotene, which is also again a retinol, which shows improvement in hyperpigmentation in moderate to severe acne. Next, we have glycolic acid, mainly in peel, which exfoliates the upper layer and addresses melasma and stimulates collagen production. After any procedure, you have to educate the patient for proper AM PM routine, and you just have to apply their sunscreen or any mild sunscreen you have, but it should be of SPF 50 minimum before stepping out in the or before leaving the patient. Okay. नेक्स्ट इज नायासिनामाइड. दिस कैन बी यूज्ड इन कॉम्बिनेशन एज आई टोल्ड यू. कोई भी मीजो कॉकटेल या डर्मा एब्रेशन कॉकटेल अगर आप मिक्स करते हो तो उसमें आप नायासिनामाइड आराम से यूज कर सकते हो, बिकॉज इट प्रमोट्स स्किन हाइड्रेशन एंड इट इम्प्रूव्स बैरियर फंक्शन फॉर, एंड इट इज ऑल्सो सुटेबल फॉर ऑल टाइप्स, ऑल स्किन टाइप्स. Okay. So this is a skin brightening and anti-inflammatory chemical. Next, and the very recent, is tranexamic acid. This reduces excessive pigmentation by inhibiting melanocyte activation. So या तो आप इसे topically use कर सकते हो, and after peels or 2-3 sessions you can also give the patient as an oral medicine. Okay, so this is basically the main ingredient which is used for melasma. Next is thiamidol, which is effective for treating facial hyperpigmentation. Again, all these are for pigmentation. So these can be integrated into daily skincare routines, and this is suitable for all skin types. Okay. Next is kojic acid, which has skin lightening properties, and these also reduce appearance of dark patches, acne spots, etc. Okay. So this is used in combination with hydroquinone or glycolic acid for effectiveness. देन विटामिन सी, एज आई टोल्ड यू, इसको भी आप बाकी कॉम्बिनेशन के साथ में कंबाइन कर सकते हो. दिस प्रोटेक्ट्स अगेंस्ट यूवी रेडिएशन, reduces melasma. It has a strong antioxidant property and a skin brightening property. Okay. Next is azelaic acid, which possesses antibacterial, anti-inflammatory, and exfoliating property. Skin, it has also skin lightening effects. Okay. And other creams and applications, these includes glutathione, soybean extract, tranexamic acid just discussed, ascorbic acid, which is nothing but vitamin C, cysteamine cream, and methimazole. Okay. Next line of treatment is glutathione. एज वी नो कि ग्लूटाथियोन इज जो अब मार्केट में बहुत ज्यादा एक कॉमन नेम हो गया है. ग्लूट इफ यू नो दैट, आई एम नॉट रिमेम्बरिंग द ब्रांड नेम. उस ब्रांड की ग्लूटाथियोन टैबलेट्स आती हैं फॉर डेली इनटेक. Okay, so glutathione is a powerful antioxidant, and it has indirect skin lightening effects. Okay, so this is capable of preventing damage to important cellular components caused by various resources sources like such as reactive oxygen species, free radicals, peroxide, lipid peroxides, and heavy metals. So this is basically a combination of three simple building blocks of protein or amino acids, that is cysteine, glycine, and glutamine. अगर आप इसका स्ट्रक्चर देखोगे तो इट हैज एन एस एच ग्रुप विच इज नोन एज थायोल ग्रुप, विच एक्ट्स एज लाइक अ फ्लाई पेपर. जैसे फ्लाई पेपर होता है ना, बहुत सारी फ्लाइज उसके ऊपर आके चिपक जाती है. जस्ट लाइक दैट, ऑल द फ्री रेडिकल्स, टॉक्सिन्स हमारी बॉडी में जो होते हैं, they come and stick onto it like that. Okay, so all the bad things in the body are free radicals, toxins like mercury, and heavy other and other heavy metals. Okay, so what are the different benefits of glutathione? It reduces oxidative stress, it improves treatment of psoriasis, reduces cell damage in alcoholic and non-alcoholic fatty liver diseases, improves insulin resistance in older individuals, increases mobility for people like peripheral with peripheral artery diseases. So these are the other benefits. So the main benefit for of glutathione is overall brightening of the skin. ठीक है. सो इसको किस तरह से हम पेशेंट को दे सकते हैं? इन द ओरल फॉर्मुलेशन, पिल सॉल्यूशन, सबलिंगुअल टैबलेट्स, सिरप्स और स्प्रेज. ओके, एंड द मोस्ट कॉमन विच इज प्रैक्टिस इन क्लिनिक इज पेरेंटल फॉर्मुलेशन, और दैट इज आईवी और इंट्रामस्कुलर इंजेक्शन. ये थोड़ा सा ना थिक लिक्विड होता है, तो इंट्रामस्कुलर इंजेक्शन में थोड़ा पेन होगा, इसलिए आईवी ड्रिप इज अ बिट सेफर. ओके, uh, it can also be administered by intranasal or intrabronchial routes as well. Okay, so you can give face wash. Just example, right? में photo है glutalite. You can prescribe face wash, topical cream, face topical spray, or you can give an topical combination. Okay, very commonly given in IV. So IV injection of glutathione have been used for years, but there is no single even not even a single clinical trial. So nowadays we recommend a dosage of 600 to 1200 mg for skin lightening, जो कि अगर आप इंजेक्ट करोगे तो वंस टू ट्वाइस अ वीकली इंजेक्ट करना है, और अगर आप आईवी में चलाओगे तो वंस इन 2 weeks विल बी ग्रेटफुल. Okay, so the duration for which they should be continued is not specified, because even if one or two shades lighter, if the patient sees, they usually say to stop this, glutathione, because when they have achieved one or two shades fairer skin, then they usually stop taking this. Okay, so what is the standard dosage for glutathione? It is 20 to 40 mg per kg of the body. Okay, this is the method. Like अगर एक patient है जिसका 50 kg weight है, तो आपको इस तरह से कैलकुलेट करना है. ओके, और ये ट्रीटमेंट आपको नॉट मोर देन 6 मंथ्स, 6 मंथ से ज्यादा आपको इस ट्रीटमेंट को आगे नहीं चलाना है. ओके, ग्लूटाथाइन के साथ में जो ट्रांसमिक एसिड है, कॉजिक एसिड, अल्फा आर्ब्यूटिन, दीज ऑल्सो वर्क वंडरफुली फॉर patient with overall hyperpigmentation. Okay, and next we come to chemical peels, as you all will be aware of that. So a chemical peel involves applying a specialized chemical solution to the skin, which exfoliates the outer layers of the skin and promotes the shedding of the dead skin. Okay, it brings about exfoliation, stimulation of collagen in the skin, reduction of melanin pigment. So what are basically the benefits of peels? It improves the skin tone by exfoliating the skin and removing damaged skin cells, that is the dead cells on the skin. It reduces hyperpigmentation, dark spots, patches. Okay, and it brings about uniform skin tone. It lightens the skin tone. Okay, it boosts collagen production, improves skin texture, reduces fine line, wrinkles, and enhances overall skin elasticity. It smoothens the skin surface. So immediately after the peel, the patient will experience a lifting effect or a smooth skin. Okay, which results in a or result in a softer or more refined texture. It minimizes pore size, and also after the peel, there will be enhanced skin absorption of skincare products. Okay, so what are the different peels that are available? First is glycolic peel. ये आप without any hesitation or doubt ये आप हर patient में हर type of skin में apply कर सकते हो. Okay, so for those with mild to moderate hyperpigmentation, this peel is often recommended. This is an AHA peel. As we know, there are three types of peel: AHA peel, BHA peel, and PHA peel. Okay. So this is a alpha hydroxy peel, which is known for its ability to gently exfoliate the skin and reduces the dark spot and improves overall skin tone and texture. Glycolic acid is particularly effective for those with sun damaged skin and specific and superficial pigmentation. Glycolic acid जो होता है वो sugarcane juice से बनता है. Okay, so it is a bit safer. Next is TCA peel or trichloroacetic peel, which is used for most stubborn cases of hyperpigmentation. These are medium depth peels, so they can address deeper pigmentation issues. Okay, just like glycolic peel, these are suitable for a wide range of and all variety of skin types. These are especially effective in treating melasma and more pronounced sunspots. Okay, you can also go for milder peels like yellow peel, pumpkin peel, and nowadays glutathione peels are also available. Okay, next are lactic acid peels. This is another mild AHA peel, which is this is basically for dry and sensitive skin. This peel is also known as the party peel. Before party, people like to get these peels for party glow. It gives you immediate lifting effect and an immediate glow. Okay, so lactic acid, it is derived from milk and it is known for its hydrating properties in addition to its ability to exfoliate and brighten the skin. So this peel is effective in reducing the appearance of dark spots and improving overall skin texture. It's great option for those who want to address hyperpigmentation without causing excessive dryness or irritation. Okay, because the sensitive skin होती है वो peel के बाद में जो top layer जो हट जाती है उसके बाद में it becomes immediately red. तो ये उस चीज को cause नहीं करेगा. Okay, ferulic acid peel, which is a very powerful antioxidant based peel that targets hyperpigmentation while providing additional protective benefits. It works by neutralizing free radicals and inhibiting the production of melanin, which makes it effective in reducing dark spots and preventing further pigmentation. This peel is often combined with other acids like lactic acid, glycolic acid, which enhances its effects and provides comprehensive treatment for hyperpigmentation. Okay, next is mandelic acid peel. For those with a sensitive skin or darker skin tone, you can consider it as an excellent choice. It penetrates the skin more slowly and gently. Okay, sorry. This makes it less likely to irritate while still providing effective exfoliation and brightening. Okay, it is particularly beneficial for treating hyperpigmentation associated with acne or post-inflammatory marks, that is post-inflammatory pigmentation. And next comes phenol peel, which is practiced outside India, but in India it is completely banned. This is recommended for severe hyperpigmentation like deep melasma, जो milder peels जो milder peel से नहीं जा रहा है या laser से नहीं जा रहा है उसमें phenol peel करते हैं, but it is completely banned in India. But still, I'll tell you why. Okay, so this phenol peels penetrate deeply into the skin, effectively reducing even the most stubborn pigmentation issue. Okay, जो milder peels होते हैं माइल्डर पील्स होते हैं जो कम कंसंट्रेशन के पील्स होते हैं वो जनरली जो स्किन की टॉप लेयर है उसे रिमूव एक्सफोलिएट करते हैं और उस पे वर्क करते हैं जो स्ट्रॉन्गर पील होते हैं या डीपर पील होते हैं वो स्किन के डीपर लेयर तक वर्क करते हैं बट दिस फिनॉल पील इज इज द डीपेस्ट पील ऐसा बोल सकते हैं इसको ओके बिकॉज इट removes all the skin layers from top to bottom okay and then it just see the effect why in outside India it is highly recommended. Look, On the left side, this man has fine line, wrinkles, age spots. Okay, around the mouth there is, heavy wrinkles, skin folds. Even just observe on the neck also. But after the peel, look, his whole face is like, he has just, reduced his age. All the fine lines are gone, all the pigmentation, age spots are gone, because all the top layers are removed. So this is aftermath of this phenol peel. The skin behaves like this. Yeah. So in A, this lady has come for rejuvenation. So B, just after the peel, this will look like this. Immediate frosting होगी यहाँ पे. And after in the evening तक उसको पूरा skin red हो जाएगा. और इस मतलब the patient has just like a baby skin कैसा होता है, वैसा हो जाता है उसको. तो इसके बाद में moisturizer and sunscreen लगाना बहुत बहुत ज्यादा जरूरी है. And look, in D, E, F, and finally in G, she has brand new skin. Okay, H जो picture है वो उसका earlier picture था, which is just kept here for comparison. Okay, so this is how phenol peel works wonderfully, but it is completely banned in India because it has, severe complication risks. Okay, next is lasers. So lasers stand for light amplification, light amplified sources by emitted radiation. So lasers work on the principle of selective photothermolysis, यानी जहां पे भी वो अप्लाई होगी वहां के जो cells हैं वो due to heat, there will be lysis of melanin pigment there. Okay, targeting melanin with precision while minimizing damage to the surrounding tissues. They help break down excess pigment and promotes control skin remodeling, offering predictable and effective results in hyperpigmentation management. So these are the different types of lasers that are available. Very excellent option is Q switch laser, which has different working wavelengths. That is in Nd:YAG, Ruby, Alexandrite, which is a gold standard treatment or laser treatment for melasma, freckles, lentigens, and even for tattoo removal. Next is picosecond lasers. These deliver ultra short pulses for finger pigment fragmentation, for finer pigment fragmentation. They cause lesser thermal damage and lower the PIH risk. Okay. अगर आप हाइपर पिगमेंटेशन का ट्रीटमेंट ठीक से नहीं करते हो तो ये बहुत ज्यादा चांसेस होते हैं कि रिलैप्स हो जाता है ट्रीटमेंट. And even the relapse symptom is pigmentation only. Okay, that is hyperpigmentation. Next is fractional lasers. These are fractional CO2 or ER-YAG lasers, which are used as adjuncts for pigment with textural issues. Okay, darker skin type पे ये ध्यान से use करना पड़ता है because the darker skin color and the color of hair is almost same. Okay, so you have to be very cautious while using this. Then there is long pulse laser, which are helpful in deeper dermal pigmentation and vascular pigment overlap. Next is intense pulsed light, that is IPL, which is basically not a true laser, but yeah, it can be commonly used for superficial pigmentation and photo damage, that is sun damaged skin in lighter skin types. These are the different laser and their working wavelength. Argon laser is used for basically vascular lesions. Argon pumped also. Copper vapor or bromide laser is used for pigmented lesions and vascular lesions. Same potassium titanyl phosphate also are used for pigmented lesions and vascular lesions. Okay, so here we come to the end of this slide.
Thank you, doctor. Doctor, we have few questions.
Yeah,
Percent of lactic acid peel when to apply this before a party.
before a party. Okay. अगर वो पेशेंट आपको ये बताता है कि